It used to be the thought when you're deciding between these two that you get a hysterectomy if you don't want future kids. You get a myomectomy if you do want future kids. Actually, it's kind of the old thought. If you're suffering from uterine fibroids and you just feel stuck, you just don't know what the best treatment option is for you, well, in this video, we're breaking down hysterectomy versus myomectomy. It's a common scenario I see in my clinic where patients are deciding which one is the best for them because they don't want to choose wrong. Well, we're going to talk about it and compare common scenarios in this video. Welcome back. My name is Eric Schmidt. I'm a board-certified OB-GYN minimally invasive gynecologic surgeon. In this video, we're going to be talking about myomectomy versus hysterectomy. My patients are commonly choosing between these two options for if they want surgery for their fibroids. And so let's talk about it right now. I did a whole video on uterine fibroids, the different background behind them, ways to prevent uterine fibroids. Check those videos out. I did them earlier in the channel, and so you can compare how the channel has grown since then. But a brief overview on fibroids. Not all fibroids are symptomatic, meaning not all fibroids necessarily need a treatment. They come in all different sizes. They may grow over time, they may not grow over time. And so fibroids are benign, non-cancerous. They grow within the uterine muscle. And whether or not they have symptoms, common ones would be bleeding. Common ones would be bloating, maybe even pelvic pressure or pain if they get big enough. But often bleeding, bloating, feeling fullness, sometimes they can get big enough where they might impact someone's ability to get pregnant. And what I'm going to do is write down a bunch of the common scenarios and how myomectomy versus hysterectomy might be impacted or might impact those different scenarios. So let me know if you like videos like this. I've been doing it on occasion and I'm just not really sure if you like it. So like the video if you do. Comment below if you want to hear different scenarios and we'll get started. For the most part, I would say 99% of the time I'm doing these surgeries laparoscopic or minimally invasive. And so just keep that in mind. That's mainly what I'm referring to, not the big cut incisions. It's pretty rare that an experienced gynecologic surgeon has to do those big cut incisions. So mostly we're talking about these minimally invasive ways. So again, the surgery, the recovery is better. I just want to give you a brief overview again. What is myomectomy, or what is hysterectomy? What is myomectomy? Hysterectomy, removal of the uterus. Total hysterectomy means removal of the uterus and the cervix, okay? Not the ovaries. That would be oophorectomy, so that's a little bit separate. And so for the most part, we're talking about retaining the ovaries when we're talking about hysterectomy here. Myomectomy, that's removal of fibroids from the uterus. Now, this again can be done through small cuts, which again, I'm talking and focusing on the small cut surgeries because that's what I do. Do that, we actually have to cut into the muscle a little bit of the uterus, take out the fibroid, sew the uterus back together. And so again, that's a brief overview of myomectomy. The procedure-related risk and the complexity of the procedure when comparing hysterectomy versus myomectomy. The procedures for both of them, doing them minimally invasively, can be very straightforward, but it also can be very complex. You know, I'm going to do plus minuses. So for the hysterectomy, as far as complexity, it can be very easy, can be very difficult. Procedure for myomectomy. It does require more what we call suturing within the abdomen and pelvis. And so often it takes a little more skill to do more suturing laparoscopically. The procedure-related complexity can be a little bit more with myomectomy. Sometimes depends on the number of fibroids, but again, a plus minus. However, there is one thing that has proven to be true in that there is a little more blood loss with myomectomy because again, we are cutting into the muscle to remove the fibroids, and the muscle of the uterus has a lot of blood flow to it, has a lot of potential ways to lose that blood quickly. And so there's a couple ways that we try to mitigate this during the surgery. Often what I do is inject a diluted vasoconstrictor. And so this constricts the blood vessels, less blood loss in that area momentarily. And then you work on getting that fibroid out and then suturing it back together in an efficient way. And that's going to help reduce the blood loss Sometimes we might also give medications. You've heard me talk about tranexamic acid for heavy menstrual bleeding as a pill. Well, we actually give that through the IV sometimes to help with surgeries where we expect a little more blood loss. And so there's ways to manage this, but like, for example, when I'm doing a pretty straightforward hysterectomy, you don't have to necessarily cut into the muscle as much of the uterus. And so there's actually sometimes pretty minimal blood loss, maybe 20 milliliters on average for a straightforward case, I would say, for hysterectomy. Myomectomy, it's probably a couple hundred if you're doing a couple removal of fibroids within the uterus. So a little bit of a difference, slight increased chance of someone maybe even needing a blood transfusion with a myomectomy. But again, that is still pretty rare. And often it depends a little bit on what the person's starting hemoglobin is. If they've had a lot of hemorrhage from their menstrual bleeding, they might have a little lower hemoglobin, might have a little increased chance of something like a blood transfusion needed during their surgery. So when it comes to recovery, when comparing hysterectomy versus myomectomy, the hysterectomy total recovery time is a little bit longer, and that's in the case of a total hysterectomy where we're removing the cervix from the top of the vagina and have to sew that top of the vagina together because that incision turns out to often be the largest incision. The recovery is about 6 to 8 weeks. But generally, patients actually feel better quicker after their hysterectomy sometimes than their myomectomy. Recovery from a myomectomy can be in the range of 2 to 4 weeks. Depends on maybe your own particular surgeon, but 2 to 4 weeks before you can resume normal activities, heavy lifting, sexual activity. And so definitely shorter, but those first few days sometimes are quite a bit more crampy because we're cutting into the muscle of the uterus. It doesn't like that. It gives a cramp in those scenarios. So sometimes a little more cramping, bloating in the recovery of the myomectomy than the hysterectomy. But overall, you recover quicker with the myomectomy. So it's kind of like a double edge there. So when we're talking from a fertility standpoint, I mean, this is pretty, if someone is desiring future fertility, hysterectomy is the answer. And so that's pretty straightforward. When it comes to myomectomy, if somebody is desiring future fertility, I mean, it used to be the thought when you're deciding between these two that you get a hysterectomy if you don't want future kids. You get a myomectomy if you do want future kids. Actually, it's kind of the old thought. And we're all about dispelling those old thoughts here on this channel. So there's more factors into it than just that. But obviously, if someone wants future fertility, myomectomy is the way to go because you're preserving the uterus. It may have some scars on it, which we'll talk about here in a second, and how that impacts. But the uterus, for the most part, is going to heal and hopefully resume normal function when it comes to pregnancy. There are scars on the uterus when we have to cut it open, take a fibroid out, and sew it back together. If you remember from before, fibroids can grow in multiple different areas of the uterus muscle, on the inside, in the middle of the muscle, or on the outside. Sometimes if the fibroids are so much on the outside, or what we call pedunculate, kind of like hanging off, I'll show a picture of a surgery I did with that and how that looks. That fibroid can be easily kind of cut off. It hasn't had a lot of what we call as myometrial invasion, pushing into the uterus muscle. So the scarring is probably going to be minimally. And someone might have the option of, depending on what your doctor says, trying for a vaginal delivery after a myomectomy. I would say for the most part, a lot of those fibroids are growing within the muscle wall. We're often talking about if it's deep within that muscle layer or even close to the inside. The recommendation is, because of the increase of the scar, how big the scar is, for likely a C-section in your delivery. Timing of that C-section might be a week or two earlier than they expected. Again, you'll have to talk to your doctor regarding that, but that's how it can impact fertility. Also, after your myomectomy, you might have to wait to try and get pregnant. This minimum, usually 3 months. And then if it's a more complex, more fibroids taken out, deeper myometrial invasion of those fibroids that are taken out, we might recommend waiting 6 months to try and get pregnant, so it's safe. The scar has enough time to fully form. So again, fertility-wise, myomectomy, you're going to want it. You might need a C-section. You might have to wait 3 to 6 months after. And I think we can do a whole separate video on the fertility and myomectomy. So I think I'll do that in the future, actually. All right. So this is often a big point of discussion when it comes to hysterectomy versus myomectomy. And the chances of what we call is future surgery or reoperation rates. If somebody chooses for a hysterectomy for their fibroids, often this is sometimes the best scenario if someone has multiple fibroids throughout the muscle. They just have a higher chance from whatever it is that they're growing more fibroids. There is a pretty decent chance that in the future they grow more fibroids. This often depends on how old they are, how many more menstrual years they have left, because again, fibroids, like hormones, they often just grow during the menstrual years. And if the fibroids are taken out, they can potentially grow back in other areas. Those fibroblast cells are still there. Fibroids can grow back. But if someone has a hysterectomy, removal of the whole uterus and cervix, theoretically, they should have a almost 0% chance of any fibroids growing in the future. Now, again, with myomectomy, there is about somewhere in the realm of 15 to 30%, maybe 40% chance, depending how many menstrual years they have left, that someone grows more fibroids. Again, doesn't mean they're symptomatic, so that would probably be even a lower percentage. You might need a potential repeat surgery if, say, someone gets a myomectomy when they're in their 30s, they have about potentially 20 more menstrual years left. That's 20 more years that fibroids could grow, potentially become symptomatic. And so someone might need a future reoperation, whether that's a myomectomy, hysterectomy, the radiofrequency ablation procedure, which I'm not talking about today, but we'll talk about in the future. And so future surgery risk, again, there is a future surgery risk with myomectomy, but again, it has a lot of other positives too, keeping that in mind. As far as percentage-wise, we say if someone has a future, there's about a 10 to 20% chance they have that future surgery because their fibroids become symptomatic again if over the next 5 to 10 years. As far as hormones go, hysterectomy, again, we're talking about keeping your ovaries. However, it still impacts the hormone function to a slight degree because the ovaries do depend a little bit on on the uterus for their blood supply. They also depend on the gonadal vessels on the other side, but they do connect to the uterus, and so we do have to go through that connection to do a hysterectomy. So the hormones are affected to some degree, so they are going to decrease a little bit. Potentially menopause, perimenopause symptoms are going to come a little bit sooner, potentially years sooner if they have a hysterectomy. But again, we have a bunch of videos talking about how to treat those, and so what that actually means and the future implications if someone's able to get hormone replacement. I think we need more information on that, but it could potentially decrease all those risks from the decreased hormone. With myomectomy, this is nice. It really shouldn't impact your hormone function at all. There's no studies that say it should. The uterus still has its normal blood flow, and the ovaries therefore should still have their normal blood flow. So it's nice that this myomectomy should not impact hormone function in the future. Let's talk about sexual function. So sexual function, it's a big topic of conversation when it comes to sexual function following hysterectomy. When people are having symptomatic fibroids or anything that's leading them to go to their doctor and talk about a hysterectomy, actually, when they did studies on this and they ask about, how is your interpretation of sexual pleasure before and after your hysterectomy, a lot of the studies show that it improved after the hysterectomy. Because that big thing that was causing all this pain, discomfort, not interested in sex is away, it's gone. And so overall sexual satisfaction improvement with hysterectomy. However, there is some interruption in the tissues of the upper vagina and the cervix being gone. There are a percentage of people that get pleasure from their cervix and the stimulation of that. We don't want to discount that anymore. And so it's a conversation. It's all good to know about yourself if that by chance is a part of it, but the sexual function, it could potentially decrease a little bit with hysterectomy. Again, however, a lot of if someone's having an issue, that's why they're getting the hysterectomy, this is better because that issue's gone. It's a complicated topic. Needs more conversation, needs more research. Sexual function, when it comes to myomectomy, hopefully isn't impacted because hopefully the symptoms are improved. There's always a chance that the bleeding, the pain, the bloating don't completely resolve, and I think that's going to be my next point. But sexual function, that really shouldn't be impacted. So And then let's say this is bleeding. Bleeding dysmenorrhea. Sorry if you can't read that. But the bleeding with hysterectomy should be gone. And so that's much improved. So it's a positive. And then dysmenorrhea, that should hopefully be gone if that's the source of the pain. There is always a chance, and I have this conversation with my patients, that yes, if bleeding is the main symptom, removing the fibroids should help. I'm almost certain it'll help. But is it going to completely get it back to what the patient desires? I can't always guarantee that. There's bleeding issues, especially if someone's approaching the perimenopause time. It's so complex. Even though we see fibroids there, if we remove the fibroids, there's always a chance that the perimenopause can be causing the heavier or irregular bleeding. There's always a chance that, you know, something else could be factoring into that too. So, you know, there's less of a guarantee. You know, it should help, but definitely won't help as much of a hysterectomy. And so, you know, again, if you have other scenarios which you want to hear about in comparison to these two, let me know. I'll get to your questions. But yeah, I mean, I hope this helps kind of get the common scenarios that I'm seeing with patients, and when we're discussing this procedure, the different points that we're talking about. So thanks for watching. Like the video if you're still already here, and we'll talk soon. All right, bye everyone. I hope you can see okay on this paper. I ran out of my white paper, so we're now working with blue.